Hi, my name is Jill. I'm a student nurse practitioner and I'm here to do your complete body exam. So we're going to start by looking at the scalp first, assessing for any lumps, bumps, masses. I'm going to check your face for asymmetry. I'm checking the colors, make sure there's no masses or lumps, anything concerning. Coloring looks good. Now I'm going to palpate for any lumps, bumps, or masses. There's none. I'm going to palpate your temporal artery. Perfect. So now I'm going to check your cranial nerves. I'm going to have you raise your eyes up, frown, squeeze your eyes tight. Excellent. Open them. I'm going to have you puff out your cheeks and now close them. Now I'm going to palpate your masseters. I'm going to have you open your mouth and close, open and close, checking for any clicking, for any TMJ, and there's none. So now what I'm going to do is I'm going to check your range of motion. I'm going to have you follow my finger without moving your head. Good. Now I'm going to check for convergence. Excellent. We're going to move on now to the eyes. I'm going to check your eyes. First, I'm actually going to close your eyes and tell me when you feel this.
Feel it.
Perfect. So now I'm going to check your eyes. I'm going to have you, I'm going to take a look at your eyelashes. They're fully intact. Your sclera is nice and white. I don't see any drainage, any running, no broken blood vessels. Good. So I'm going to have you stare over my shoulder. I'm going to check your direct and consensual. So first direct, I'm going to check your pupil on that eye. Now the opposite eye for consensual. Excellent, excellent. And on the other side, direct, and now opposite, consensual. Perfect. So now we're going to dim the lights, and I'm going to actually look into your eye. My right hand, my right eye, your right eye. I'm going to hold up. Perfect. So I see the red light reflex, the disc, and the cup. Excellent. We're going to move on to the other eye. I'm going to take a nice look. All right, good. Same thing, disc, cup, red light reflex. Perfect, healthy. Okay, so now I'm going to move on to the nose. Checking for any deviation. I'm looking, there's no drainage, nothing running, doesn't look like you have a cold of any kind. I'm going to check for patency. I'm going to have you just breathe out with one nostril. Now breathe out the other. Excellent. I'm going to just check the inside. I'm going to check the mucosa. I'm checking, excellent. The turbinates, good. And same thing on this side. And excellent, good. Okay, so now we're going to move on to the ears. I'm going to start by just looking at them, looking for anything concerning, any lumps or bumps. Now I'm just going to feel. Good. I'm going to do a quick little whisper test. I'm going to whisper 3 words into your ear, and I want you to repeat them back to me.
Car, bird, kite, kite, bird, peanut butter.
Excellent. Okay. So now I'm going to look in. I'm going to pull up and back. I'm going to take a nice look. I'm looking for any serum or any fluid. Everything looks nice and dry. Your tympanic membrane is a pearly gray. Excellent. And on the other side, same thing. I'm going to take a nice look in. I'm going to pull up and back. And perfect. I'm looking for any serum and their tympanic membrane is pearly gray. Beautiful. So now that the ears are done, we're going to move on to the mouth. So what I'm going to do is I'm going to take a look first at your smile for me. Good. I'm going to take a look that the gums are nice and healthy. Your lips are nice and pink. Mucosa looks good. I'm going to have you stick out your tongue. Perfect. I'm going to take a nice look while I'm in there. I'm going to check the soft palate, the hard palate. Your uvula is nice and midline. And now I'm going to have you go, ah. All right, good. To check your gag reflex. All right, and everything looks good there. So now we're gonna move on to the neck. I'm looking for any scars, any lumps or masses, anything sticking out at me, and nothing is noticeably wrong there. So now I'm gonna palpate for your lymph nodes. So I'm gonna first do pre-auricular, post-auricular. We're gonna go behind the neck for posterior and occipital. Good. We're gonna come back along. We're gonna check for submandibular, submental. Good. Now we're gonna do clavicular. Good. So now I'm gonna just check your muscles. I'm gonna have you push up against my resistance. Excellent. So that's good. So now I'm gonna check your trachea is midline. We're gonna do your thyroid. We're gonna do a quick little thyroid test. So I do look and see there's no goiters of any kind, nothing suspicious sticking out to me. I'm gonna go behind you. So I'm gonna have you take a sip of that water. We're gonna find your isthmus, and now I'm gonna turn your head to the right, and I'm gonna have you swallow, and I'm gonna palpate as you swallow. Excellent. So you feel the rise and the fall. Same thing on the other side. I'm gonna have you take a sip, hold it in your mouth, and don't swallow until I tell you to. I'm gonna turn your head slightly to the left. All right, swallow. Perfect. Same thing, rise and fall. Thyroid is good. Okay, so that's your upper body, your HENT part. So now we're gonna move on. Now we're gonna check your lungs. So with that, I'm gonna first take a look at your chest. I'm gonna check out your breathing. You can see that it's unlabored, easy breathing. There's no problem with that. I'm gonna check your 2-to-1 posterior to anterior ratio, so that's good. I'm looking for any scars on the chest. I don't see any scars. I don't see any injuries. Nothing suspicious sticking out to me. So now what I'm going to do is I'm going to percuss the area. I'm going to do the front and the back. Okay. On the side. Good. I'm going to do the same thing to the back. On the side. On the side. Good. So now I'm just going to actually listen to the lungs that, excuse me, in that exact spot. And I want you to take a deep breath in for all these spots that I go to once I move my stethoscope. Feeling dizzy, you don't have to do the full thing. I'm going to go to the back now. Last one. Okay, now you can just breathe normal for me. Okay, good. So your breathing is clear. So now that concludes your lung test. So now we're going to check cardiac. So I am going to take a look at you sitting. I'm going to look for any heaves of any kind. I'm listening for any bruits, which I don't hear out loud. I'm going to take a look, and then I'll have you lay down, and we'll look later on as well. But first I'm just going to do, I'm going to listen to a couple spots, okay? So first I'm going to listen to the right sternal border, second intercostal space, your aortic. I'm going to listen to the pulmonic, second intercostal space, left sternal border. Then I'm going to listen to Erb's point, left sternal border, third intercostal space. Then I'm going to listen to the tricuspid, left lower sternal border, fourth intercostal space. Then I'm going to listen to your mitral, which is fifth intercostal space, midclavicular. Perfect. All right, very good. So now I'm going to have you lay down. Good. So now, same thing. I'm going to look while you're laying down. I'm going to check for any lumps, bumps. I'm going to look for any heaves of any kind, which I don't see while you're laying flat, which is good. I'm going to come over here, and now I'm going to listen. I don't need to say the names again. Excellent. Okay, so that concludes cardiac. So now while I have you down, we're going to do an abdomen assessment. Okay, so I'm going to check your... Okay, so this is your stomach here. We're going to leave your shirt down just for the purposes. First I'm going to take a look at the stomach. I'm going to check for any striae, any surgery spots, any scars, anything that looks like there's been something done. And now I'm going to start by, I'm going to listen first. I'm going to listen to all four quadrants. Your upper right, your lower right, your lower left, and your upper left. Good, so you hear hyperactive bowel sounds. That's excellent. So now I'm going to percuss. Good, and now I'm going to palpate. First I'm going to do light palpation. Now I'm going to go a little harder. Good, so now we're going to palpate for the liver. So I'm going to start percussing to right about there. Okay, I'm going to have you take a deep breath in and hold it. Okay, so liver not palpable. All right, good. So that concludes the GI. Now we're going to move on to vascular. So what I'm going to do is I'm going to start by, I'm going to look at your arms. I'm looking for anything that shows me that you have bad circulation. I don't see any scars, any marks, nothing concerning. I'm going to feel that it's nice and warm. So nothing concerning there, no swelling. I'm going to check your pulses. So I'm going to check your brachial pulses, radial pulses, and I'm going to check your capillary refill. Perfect. Good. Less than 2 seconds. Now we're going to go down to the legs. So I'm looking at your legs and they feel nice and warm. The color looks good. I don't see any signs of nothing static down here. No swelling of any kind, nothing concerning that there's bad blood flow or circulation. I'm gonna check your capillary refill. Good, less than 2 seconds. Now I'm going to feel for pulses. I'm gonna check up here for your femoral pulses. Good, I'm gonna go behind the legs. You could bend up just a little bit for your popliteal pulses. Good, we're gonna go, I'm gonna press to see if there's any swelling, which I don't see. I'm gonna feel your pedial pulses. All right, then we're gonna go to the tibial pulses. Excellent, so that concludes your vascular. So last thing we're gonna do is muscular. I'm gonna have you stand up for me. So we're gonna check your muscular. First I'm gonna have you, I'm gonna stand behind you. I'm gonna have you bend over so I can check your back, your spine. Bend over, touch the ground. I'm gonna check that your spine is nice and straight. It's a nice C curve, so nothing concerning of any kind. I'm gonna have you stand up. I'm gonna have you turn around and face me. I'm gonna have you put your hands on your hips. I'm gonna have you kind of bend to the right, bend to the left, bend to the right, bend to the left, and then can you turn right, left? Perfect. So that's your muscular, so you could have a seat. That shows range of motion, and that concludes our exam for today. Okay?